This is TTT Live. I am DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, Dr. Anthony Parkinson, Technical Advisor, Hospital Services in the Office of the Chief Medical Officer, and Dr. Roxanne Mitchell, the Acting General Manager, Primary Care at the Tobago Regional Health Authority, who is joining us virtually. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning. Good morning to Dr. Parkinson and Dr. Roxanne Mitchell, my colleague from Tobago. Good morning. Ladies and gentlemen of the media, a very good rainy morning to you, and all viewers and listeners, wherever you are, good morning. I normally like to give the global update, as you know. Ladies and gentlemen of the media and the listening and viewing public, the global outlook continues to be of concern to all health professionals around the world. The rates of infection, as we indicated here, is about 140,000 per day. When last we were here on Monday, it was just about over 8,000. Today, 48 hours later, 8 million. Today, 48 hours later, it's 8,307,781. It means in the past 48 hours, the rate of increase in cases is sticking to its plan of 140,000 cases per day globally. There is no slowdown in the number of new cases around the world. I want Trinidad and Tobago to understand that. There's no slowing down of coronavirus around the world. To date, 447,108 persons have in fact died. And we in Trinidad and Tobago, unfortunately, have contributed 8 to that total. The number of persons around the world in a critical condition, and Dr. Parkinson, who is here, can talk to you about what a critical condition means, is 54,533. And the bulk of those people may not have a good outcome. Before I give you the clinical update for today, there are 2 occurrences, one in New Zealand and one in Beijing, China, which I think needs to be brought to the attention of the media and of Trinidad and Tobago, because it is related to what types of requests for exemptions from quarantine both the Minister of National Security and myself continue to get on a daily basis. People are asking us to leave quarantine to go and visit a dying relative, leave quarantine to visit this one. Could we allow somebody to come into the quarantine center to visit someone? And the answer has always been no. And it's not that both Minister Young and myself want to be harsh. It is based on the protection of society. And I want to give you an example of what happened in New Zealand within the past 24 to 48 hours. Now, New Zealand, and I want to congratulate New Zealand and the Prime Minister, Jacinda Ardern. They did a fantastic job, absolutely fantastic job. But because of one failure in quarantine protocols, where 2 sisters from England came in to visit a dying relative, dying parent, and they were quarantined. And for some reason, they were allowed to leave quarantine early on compassionate grounds. And we get those requests all the time here. could we allow this person to visit a sick relative? They were released early from quarantine and undertook a trek through New Zealand. That trek has resulted in 320 new cases of coronavirus. 320, because 2 sisters were allowed to leave quarantine early on compassionate grounds. That is what we are trying to avoid in Trinidad. So all the requests that come to allow people to leave before 14 days, to visit a dying relative, we understand this is difficult. No one asked for this, but we have this situation to manage. And I just want to quote what Prime Minister Ardern said. She said, this case represents an unacceptable failure of the system and should never have happened and cannot be repeated. That's New Zealand. On Monday, we would have said here, so far, the rollback of our, what we call our lockdown measures are going well. We haven't had to roll back anything. We are moving forward. In Beijing, China, there's a new cluster of 137 cases, which has resulted in Beijing rolling back their reopening. They are going to what is called a soft lockdown. Ladies and gentlemen, I bring these 2 global examples, one from Beijing, China, and one from New Zealand. In the case of New Zealand, they are now employing the military in their airports and borders. That is how seriously they have taken that lapse in their quarantine protocols. So it is not that either Minister Young or myself want to be hard or we are unfeeling. We must learn from these examples, especially in New Zealand. So I hope the public appreciates what we are trying to do, which is to save Trinidad and Tobago. What is our local situation? The total number of tests done, 4,152. Total number of unique patient tests, 3,610. Total number of repeated tests, 542. Total number of community tests, all negative throughout Trinidad and Tobago, 1,663, of which 186 were done in Tobago. What is the status and occupancy of our quarantine facilities? Right now, as we speak, we have 560 persons in our quarantine facilities. We have 32 in the UE Debe Penal campus. That includes 5 persons that were taken off the Disney Fantasy cruise ship yesterday. Remember, 6 were taken off who were tested positive, sent to Cora. 5 more persons were taken off yesterday, not because of COVID, they are COVID negative, but we had to manage some other non-COVID medical issues on land. So the total number of persons taken off the cruise ship will be 11, the 6 positive, and 5 yesterday who are COVID negative. I want to stress that, but they needed on-land medical management. At Chancellor, we have 14. At Tacarigua, we have 29. At Napa, we have 12, but Napa, as you know, is reserved for healthcare workers. Home of football, we have 8. At Sangre Grande Brooklyn Center, we have 24. Those were the 24 nationals who returned from Venezuela. On the cruise ship now, we have 295 persons because we took off 11. UE Canada Hall, we have 100 persons. These are the students who came in from Jamaica. I am happy to report that all were swabbed and tested. We received the results yesterday, and happily, all are negative. At UE Freedom Hall, we have 46 students from Barbados. They were swabbed yesterday, and we should get their results today. And let's hope for another good result. Expected today will be 17 persons from the Norwegian cruise line. They will be quarantined in Debe. And then, as expected, the 49 workers being housed at Kapok, and they will be paid for by their employer. So you can see it's a very busy time for us. We have a lot of people in our parallel healthcare system. Right now, as I said, we have 46 in quarantine facilities. And within the next 24 hours, that will go up to 626. So that's a large number that we are dealing with right now. So Minister Cox, that's my little advice today as to why we can't let people leave quarantine early. Let's learn from the New Zealand case. Advice on let us protect the gains we have made in reopening the economy and learn from what has happened in Beijing. And that's my clinical report on where we are today. Thank you very much.
Thank you very much, Minister. Very good advice, very good information. Dr. Anthony Parkinson, Technical Advisor, Hospital Services in the Office of the Chief Medical Officer, will speak to us on emergent use of steroids in the ICU setting.
Thank you, Minister. Morning, everyone. So we have some breaking news concerning steroid use in the intensive care or any treatment of COVID. Now, first of all, let me make a disclaimer. There is no cure for COVID yet. We do not have a cure. This steroid treatment is something that a lot of scientists were looking at, including doctors in Trinidad and Tobago as well, to try and see if we could reduce the mortality due to COVID. Now, what exactly is happening this year? When you get infected with the COVID virus, the virus multiplies, replicates in your bloodstream, in your tissues, and eventually, after a while, it causes this serious autoimmune reaction, meaning that your body, instead of fighting the virus alone, it begins to fight you, your body, destroying your lungs, attacking the kidneys, in some cases attacking the heart as well. Now, steroids, when you give someone steroids, it's a wonderful drug, powerful drugs. There's a whole group of steroids. These come against this inflammatory reaction. They come against the immune system and they dampen them down. If you give the steroids too early, your body will not be able to fight the virus. Timing is essential. You have to give the steroids when the body is now fighting itself. And this is what happens when, by the time the patient reaches ICU or HDU, the virus is there, but it's kind of been under control. The body is taking care of it. But now there's a wound up war. The body doesn't know who to shoot at. It's shooting both at the virus and at the body, at the lungs itself. At that point in time, steroids are given. And steroids seem now to quieten down that storm, what they call a cytokine storm. Every time these cytokine storms show themselves, the patient gets worse. Oxygen requirement goes up. You can't breathe. Pressure drops. Temperature goes up. Patient goes into a serious state of stress. And this is what commonly leads to death. Steroids now are coming in now to try and calm that storm. And studies have shown in England that it has reduced the mortality of patients who are on the ventilator by as much as 30%. That's a big difference. I know it sounds small, 30%. I wish it was 100%. Yes, it's not a cure, but it reduces by 30%. You have a good chance of surviving it. Those who are in HDU, high dependency unit, who are on oxygen, and the oxygen levels are increasing, you put them on steroids as well, and they seem to improve. At least 20% of them seem to have improved. So, in a nutshell, steroids are wonderful if you use it at the right time. The particular steroids they've been using is something called dexamethasone. It's a very cheap, it's a generic steroid, readily available. We have it in Trinidad. In fact, we use it very commonly in many aspects of anesthetics and in medicine. We use it very commonly. It is available, and the dose is rather small. The dose is about 6 milligrams. We sometimes use up to 12 milligrams at a time. So we do have the drug. If we do get cases like this, we know what to treat them with. I want to give some kudos to our doctors in Trinidad and Tobago who are facing in the ICU, who are facing these patients. Remember when we first started, we didn't know what to use, and people were trying different drugs and hoping for the best. They began to use not necessarily dexamethasone, they were using something called prednisolone, same class, virtually, not as powerful as dexamet. And they were using it at the right time, and they did get fairly good benefits from it. In fact, they have some studies coming out of it right now. So yes, Trinidad, yes, we in Trinidad have been using these steroids before, and we have found some benefits. England has shown, let's use the dexamethasone. It's cheaper, it's available, it's potent, let's use it. But I want to make a clear statement. This is not a cure. Do not go on hoard steroids or start taking steroids. Remember what I said? Steroids, if taken too early, will make the virus worse. However, it's the timing. When the virus has taken hold and you're deteriorating because of your own cytokine storms, your own inflammatory reaction, that is when the steroids are going to be useful. That's when the doctors are going to give it to you at HDU or ICU, not any man on the street. Do not take steroids for COVID-19. That will be very dangerous to you.
Thank you very much, Dr. Parkinson. Dr. Roxanne Mitchell, the Acting General Manager, Primary Care at the Tobago Regional Health Authority, will provide the Tobago perspective on the COVID-19 response, and she will be joining us virtually.
Good morning, and thank you, Minister Cost.
Good morning.
Good morning, ladies and gentlemen.
Hello, Roxanne. How are you?
Good morning, sir. How are you? I'm
My
fine,
friend.
thank you. How are you?
My friend.
With regard to the Tobago perspective on COVID-19, as many would know, our journey began on February 20th with the returning national from China. That started our initial response in terms of review of our surveillance mechanism. We looked at the development of plans to address quarantine, isolation, as well as the clinical management of suspected cases if at any point in time we were to have such cases. We also looked at our border control measures in conjunction with the measures implemented by the Ministry of National Security. We would have had stakeholder meetings which were geared towards not only sensitization of the public, but also information sharing and the alleviation of fears and concerns that seemed to be rampant at the beginning of the COVID-19 pandemic. There was a need to include sectors beyond health. Within primary care, we have the chronic care model where we look at health as not just the medical aspect or the clinical aspect of care delivery, but also the psychosocial aspects, economic aspects, and factors that affect individuals and their access to care. So we included other sectors in what we call the Tobago COVID-19 multi-sectoral task force, which meant rather frequently and kept in alignment with both national and international guidance with regard to our response to COVID-19. Specifically, as we, within the different sectors, within primary care, we began with ensuring we continued the delivery of maternal and child health services. That would, of course, include our family planning as well as our immunization and vaccination programs. We looked at the general implementation of our block appointment system in terms of reducing the number of persons that would gather at a particular facility, and that helped tremendously. They were also scaling down of certain services to ensure that, again, we reduce the number of persons that will gather and that we can effectively treat persons, be it suspect COVID or not, and persons with non-communicable diseases. Part of that would have been the early initiation of our 2-month supply of medications, where we would reduce the unnecessary travel on persons during this particular period. COVID-19 has led to a number of positives, which would include telemedicine. It also led to the upgrade of our laboratory facilities. This would have happened, but it accelerated the process. But a particular feature would be the introduction of the PCR testing here on the island, and that is a big leap for us here in Tobago. We have installed our PCR machine. We are in receipt of our test kits. They are here in Tobago at present, and we are awaiting the arrival of the PAHO representative as well as the Ministry of Health representative to ensure that the lab personnel are sufficiently trained in carrying out the testing of suspected cases on the island. Surveillance testing will continue in Trinidad. We are also finalizing our arrangements with regard to the parallel health system for the clinical management of cases. We are in the final process of organizing a facility at the Scarborough Regional Hospital, that is the old site of the hospital, the Tobago Hospital. And we are going to maintain the separate ICU unit, the COVID-19 ICU unit at the Scarborough General Hospital, which is the current facility. Within the non-healthcare sector, there was a shift towards what we consider the new normal in terms of signage, and you can see it outside many business places, signage instructing persons regarding preventative measures. There's an emphasis in a number of places on hand hygiene practices. You either see the number of sinks on the outside, or you have within the establishments the alcohol stations or alcohol gel stations. And of course, we have our social distancing, which includes our physical distancing and markers. The journey was not without challenges, and the major challenges experienced on the island would be the varying levels of acceptance or social distancing measures, especially that of physical distancing. We are very sociable people. So getting together, just like in Trinidad, is something that is a key part of who we are. So we have had varying levels of acceptance, but I think for the most part, we are adhering to those measures. Availability of PPEs initially was a challenge for us, as well as the rational use of PPEs. But as time went by, we sorted those particular challenges out. The psychosocial effects of the preventative measures are key. And we have seen where the Division of Health, Wellness, and Family Development have implemented a number of programs and to ensure that persons get the type of support that they require at this particular time. The socioeconomic effects faced by a number of persons are also being currently addressed. And as we move towards our implementation of our socioeconomic platforms or socioeconomic safety nets, psychosocial supports, we are asking the general population in Tobago to contact us. If you do have issues, if you do have adjustment issues, please contact us. We are here, we're willing to help, and we will try as much as possible to transition us into this, what we call the new normal. And before I go, I have to emphasize what the minister would have referred to in terms of our preventative measures or respiratory etiquette. We are still calling for persons to cover their coughs and their colds. We are moving into the hurricane season and then swiftly into what is traditionally known as the flu season in September, October. And we need to keep in mind that we still have to cover our coughs and our sneezes. We also have to consider face masks as part of our new normal. And I'm encouraging persons, please, when you're wearing your face mask, to cover both your mouth and your nose. It is not sufficient to simply just cover the mouth alone. All right, we need to do our part in terms of protecting each other. Once I wear my mask properly, I will protect you. You wear your mask properly, you will protect me. Hand hygiene must be emphasized. In a number of places, the sinks are outside, yes, but persons are not using the 20 seconds to ensure that the detergent or the soap actually kills the virus moving forward. So I'm asking persons to pay attention, please. 20 seconds with regard to soaping the hands and to rinsing the hands properly. This also applies when you use the alcohol rubs or the alcohol itself on your hands. Social distancing again. I know we have relaxed some of our restrictions so that we are gathering now in churches. Of course, we must maintain the physical distancing aspect of the social preventative measures. So I will caution the public in general because we do not want to have a community spread starting back up starting in Trinidad and Tobago. So my caution would be to ensure that we pay attention to our preventative measures, that we pay attention to the way we communicate with each other, that we grasp and we take hold of the new opportunities provided in terms of our virtual platforms, and our telemedicine in terms of conducting our businesses. Thank you, ladies and gentlemen.
Thank you very much, Dr. Mitchell. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
Good morning to the panel. Stephen Cummings, 98.1
Good morning.
FM.
Good morning.
I have 2 questions. Well, actually, the first one, I believe, was already addressed, and that had to do with the dexamethasone issue. I know that is going to be a discussion for quite some time. But my 2 questions are of a sort of technical nature, and I leave it open to the panel. Any member can choose to take this. I read where there is one statistical view which says that about 19 out of 20 patients with coronavirus recover without being admitted to hospital. And of those who are admitted, most also recover, but some may need oxygen or mechanical ventilation. Have we found that to also be the case here in Trinidad and Tobago in our treatment process? That's my first question. And the other has to do with, in reference to the more technical aspects of treatment for COVID. At what stage is the decision best taken to decide whether a patient would be required to go on mechanical ventilation as opposed to other types of ventilation, or say oxygen in treatment, in treating COVID-19? Thank you.
Dr. Parkinson.
Dr. Parkinson?
Yes, ma'am. Okay, first of all, yes, the pattern of disease is reflected in Trinidad and Tobago. We see the same pattern. Majority of patients, virtually 80%, will have virtually no symptoms. Mild symptoms, virtually no symptoms. 15 to 20% will end up in the hospital, needing further care, oxygen assistance, and then further deteriorate. Some of them, about 2.5 to 5%, may deteriorate to require ventilation itself. So we have seen that as well in Trinidad. We had about, in our ICU, about 6 people in our ICU for the whole duration of this COVID period. We also had about 15 to 16 people in our HDO as well. Compared to the number of patients who were in CORA, that's a big difference. Now remember, CORA, we put patients in CORA not because they were sick, not because they were sick, but because we needed to isolate them. But while they were in CORA, we were looking at them to make sure they didn't deteriorate. So yes, the pattern of disease is similar throughout the world. We see it here as well. Concerning the decision to put somebody on oxygen, that's simple. You deteriorate, and at that point in time, your body is fighting itself. The immune system is taking over, and it's having collateral damage, as it were. At that point in time, the lungs need more oxygen. And we measure your oxygen. There are some devices we have, what they call a pulse oximeter, put a device in your finger, and we can measure the amount of oxygen in your blood. Based on that, and other things we do, something called a blood gas, which we actually take a sample of your blood and put it through a machine called a blood gas machine that tells us exactly how much oxygen and carbon dioxide, etc. you have in your blood. Based on that, we put you on oxygen. But at that point in time, while we're looking at you, we're not just watching to see how well you're being oxygenated, how well you're being ventilated, meaning that it was one thing to get oxygen into your lungs, but you also have to get carbon dioxide out. You'll see people when they get into respiratory distress, they may be taking deep breaths, but they be taking rapid breathing because they're trying to grasp as much air as possible to get into the lungs, to get into the bloodstream. What we do, we look at people and try to intubate them. That means take over their respiration, take it over, to put a tube into the lungs, as we demonstrated the last time I was here. And in that way, we want to do that in a timely manner. We don't want to wait until all else is lost. We have no other choice. Let's go ahead and do this. Because that itself is a tricky procedure. Many patients have died, not in COVID, of course, in other instances. Many patients have died who we have left for too long a time and then rush to put in a ET tube, an endotracheal tube, to intubate them so that we can put them on the mechanical ventilation. Now, I know what you probably read too, and I'm glad that you're reading these things, is that the rest of the world is trying to say, let's delay intubating these people. Let's delay putting them on the ventilator, because we seem to say or see that the majority of people, up to 50% or more people who go on a ventilator, they don't make it. So other parts of the world have been trying to use a non-invasive ventilation, which is basically a type of ventilator with just as a mask you put on, no tube going into your lungs. You are awake, you are alert, but it gives you a pressured breath so that you're able to breathe a lot easier. However, patients do deteriorate and they need ventilation. At that point in time, that's because they're reaching such a bad state, they need ventilation. It's not because we're trying to put a machine on them so we can relax and sit back. It's because they've reached such a bad state, we have no choice but to intubate and ventilate. Unfortunately, these are the people who actually get worse. Not because we ventilated them, but because they are actually getting worse.
Thank you, Doctor. I-95.5.
Good morning to everyone. Whitfield Turner from I-95.5. My first question would be for Dr. Mitchell. Doc, can you tell us the number of beds and trained contact tracers that we have available in Tobago, and whether you think those numbers are sufficient going forward? And my second question for Minister Dayal Singh. Quite a few persons have been asking me to ask this question. With more and more persons returning to work, more and more persons are now asking what are they to do with their children as daycares remain closed and not everyone can work from home. Now, I know you said some time ago that daycares aren't likely to reopen before schools do. However, there's a suggestion now that there can be a partial reopening of daycares for persons with nowhere else to send their children under similar guidelines as those for churches. For example, using the square footage to determine the number of children to be housed there, and of course, proper sanitization. That would limit the number of children in any one space and allow parents to work, to go back to work. Is this something that can be considered in part or in whole, especially since we don't have pandemic leave being considered anymore?
So let me take the second part first, and then Dr. Mitchell will go. The Chief Medical Officer, on more than one occasion, and also the Prime Minister, has addressed the issue of babysitting, daycares, and the dangers of this thing. So I will defer to the Chief Medical Officer, who has said clearly that children cannot social distance, especially young children. Do we allow it? And then when people die, are you going to hold me responsible? The world did not ask for COVID. All countries are developing policies in the best interest of its population, balancing a series of conflicting needs. We in Trinidad and Tobago are erring on the side of caution to preserve lives. I understand and we empathize it's a very serious social issue. And the Chief Medical Officer has said very clearly that he will advise against the opening of daycares to protect the lives of those children and their families. And parents will have to look for alternate solutions, maybe family babysitting. The community may have to get together. So that's where we are with that. And Dr. Mitchell can answer her part of the question now.
Okay, Dr. Mitchell.
Thank you, Mr. Dayal Singh, Honorable Minister, Minister Cox. With regard to the number of beds that we have available, we have 4 ICU beds that are dedicated strictly to COVID on the island, if it becomes necessary. We also have 16 beds available for the treatment and management of suspect cases, and those will come on stream as early as Monday. As from today, we begin outfitting the facility up at the old Scarborough Regional Hospital. As it regards contact tracing, at present, we have sufficient for any contact tracing that we require. And if we do need to scale up, primary care services have an additional 6 that can be injected immediately. And then we will incorporate the remainder of staff as required to increase contact tracing and surveillance on the ground. So, Mr. Turner, yes, I would say we have sufficient contact tracers at present. And for our load thus far, we do have sufficient beds. Thank you.
Thank you. Newsday.
Hello, morning.
Good morning.
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 Morning, Olive Gonzalez from Newsday. Minister Dayal Singh, I have 2 questions for you.
Sure.
I'd like to know, has the ministry made a decision on whether SEA students will be required to wear masks during the exams? And I would also like to know, has the ministry considered allowing these students to use shields as an alternative? My second question, what is the impact of the increased cases on the phased reopening of beaches and other areas? I'd like to know, will these cases impact your recommendations on moving forward into the next phase? Thank you.
Thank you very much for the 2 questions. So the Ministry of Health has advised the Ministry of Education, and it was made public, that for children sitting exams, they will not be required to wear masks. What will be required is physical distancing. Who will be wearing masks will be the invigilators as they move around the room. Your second question, would this increase in cases of 6 cases impact on the reopening? The answer is no, because these are 6 persons who we have in quarantine, who we identified in quarantine, and because of our quarantine policies, they were never allowed to go into the community, as what happened in New Zealand, which spawned 320 cases. That is why our protocols have benefited the health protection of Trinidad and Tobago. So the 6 cases coming from that cruise ship will no way impact the further opening of the economy. But thank you very much for asking that.
Thank you. We move to TV6.
Morning, everybody. Urvashi from TV6.
Morning.
Minister, I'm looking at that brief comparison of the Chancellor Hotel. That's from Saturday to today. We saw that there were 12 persons there on Saturday, 14 today. And also the heliport and Shive there today. Before I go to my second question, can you just tell us where those numbers came in? I don't believe that they came from the cruise ship cohort.
Okay, so Urvashi,
You heard that clearly.
the exact details about individuals I wouldn't have. I just get the gross numbers, but we could look into that and answer you at a future date.
Let's hear your second question, please.
Just repeat the second question, please, about a heliport.
Well, I was also comparing, we're told, well, the TT Defense Force, they send out a daily brief of the person's quarantine, and we saw that people are being quarantined at the heliport in Chagaramas, that there were 21 there on Saturday and 45 there today.
At the heliport in
So
Chagaramas?
I'm wondering where they came from.
I will have to check on that for you. I will have my Corpcom person who is here now check on that, okay? But I can give you the figures for Chancellor. Of the 14, 5 of those persons came in from, they were brought in by a company called Demas, and they are paying for their own quarantine. 1 from Antigua that came in on the 11th, 7 from Miami, and 1 from the Chagaramas Pacific Duchess. So those are the numbers being held, well, not held, quarantined right now in Chancellor, but we will try to get the answers for the other parts of the question.
Okay, 91.9.
Hi, good morning, everyone. Boo next to 91.9 FM.
Good morning.
Minister, I just want to ask 2 quick questions. How would this payment of these increments that has been promised affect the budget that the Ministry of Health went to the government to get recently? Is there enough in the budget to cover that? And I also wanted to talk on behalf of the cultural persons in the country. They've been asking about how cultural activities could be considered. One president of one of the associations said that they will be able to conduct particularly calypso activities or sit-down activities while practicing some distancing, and they think that it could be facilitated. And a number of our cultural ambassadors, performers, and so on are at this point without work or without any kind of income. So they are asking, what is in place for them? Because we've heard about bars, but nothing about cultural activities specifically has been mentioned. If you could speak to your recommendations for those, that would be helpful. Thank you.
Okay.
Good morning.
So thank you. So the first issue, as I indicated yesterday in an urgent question at the Parliament, I met with the CEOs of all the RHAs yesterday, and this is how I transact business quietly, without fuss. And we made arrangements, and I want to thank the CEO of North Central RHA, Mr. Davlin Thomas. I also want to thank most sincerely the Minister of Finance, the Honorable Colm Imbert. Mr. Davlin Thomas informed me last night, because we were keeping tabs on this, that he has in fact received the monies, I think it's a total of $39 million, from the Ministry of Finance, so it does not affect the health budget. So the increments will be paid 100% in very short order. On the issue of cultural activities, I signed off yesterday, as I do all the time, on the new protocols for every aspect of national life, whether it's construction, manufacturing, dining. And yesterday we signed off the new normal for cinemas and theaters. So theaters will be covered under the cultural, so the cultural aspect that you were speaking of will be covered under theaters, and that has actually gone out for their consideration. We await their feedback, and so we could look forward to some sort of opening of cinemas and theaters.
Thank you. TTT?
Good morning. My question can be answered by either the Health Minister or Dr. Parkinson, and it's going back to a statement made earlier by Dr. Parkinson about the steroid dexamethasone, I believe.
Yeah.
For clarity, is it that this drug is available over the counter? And if yes, what's in place to manage or prevent the hoarding that you spoke about and misuse of the drug?
Let me speak to that. Okay, so I will take that question. Steroids ought not to be sold over the counter. Notice my words, ought not to be sold over the counter. However, they are in fact sold over the counter in Trinidad and Tobago. That's a fact. It has been going on for 50, 60 years now. You can buy prednisolone over the counter. You can buy dexamethasone. You could buy almost any steroid over the counter at many pharmacies. Some pharmacies don't do it, which is the correct practice, but some pharmacies do in fact do. So the point that Dr. Parkinson made, you remember when hydroxychloroquine came out as this miracle drug for COVID, that persons actually went to pharmacies, bought it and hoarded it, and it resulted in an artificial shortage where people suffering from lupus especially could not access the drug. So the advice is, if I could amplify the advice of Dr. Parkinson, this drug is not a cure. Let us repeat that. It is not a cure. Also, it should not be taken prophylactically, meaning you don't take it and hope you don't get coronavirus. As a matter of fact, if you take it ill-advisedly, it depresses your immune system and you may open up yourself to other infections. Mm-hmm. Correct, Dr. Parkinson?
Yes, that's quite true.
So it is not to be taken what we call prophylactically. That is in the hope it prevents you from getting COVID. So there is absolutely no need to buy it with OTC, to hoard it, and that is why we brought Dr. Parkinson here this morning, because I knew that this was going to be an issue, and rightly so. So we wanted to educate the public, healthcare providers, that the use of dexamethasone to treat COVID is only reserved for the hospital setting. especially in the tertiary setting, intensive care unit, high dependency unit. It is not to be used by the public ill-advisedly.
Thank you very much. We move to Express.
Good morning. Good morning,
Good morning.
ministers, doctor. Yes, thank you. Morning, Kim Bodram from the Express.
Morning.
Minister Dayal-Singh, I'm forced to come back to the issue of exemptions, quarantine, entry, etc.
Yeah, sure.
We have a letter from a group in the UK. Of course, it's one of several groups trying to come together and come home. And this letter is basically directed at the CMO, Dr. Parasram. And the letter is strongly worded in that the group is denouncing at this stage the way in which exemptions and entries are being handled. With all due respect to the issue, but they are saying, can we not move more quickly at this stage? We don't know how long this thing is going to go on for. And because, can we not find a way, I want to use the word trust, is it that we are never going to consider trusting citizens to quarantine themselves? And are there not mechanisms that can be put in place to ensure that they do as they come in?
Okay.
And can we not also very quickly start to expand on allowing people to stay in hotels when they are being paid for by their companies? Essentially, how can we speed up this process?
Okay. So the issue of exemptions is not the domain of the chief medical officer. So that is fact number one. So I am not going to hold the chief medical officer accountable for granting exemptions. The granting of exemptions is done by the Minister of National Security after he consults with the chief medical officer and or myself. So any application for exemptions is to be made to the Minister of National Security. On the issue of trust, I don't know if you were absent for the first part when I gave the example of two sisters in New Zealand who were trusted to leave quarantine early to visit their dying parent. It turned out they were COVID positive, and that spawned 320 cases in New Zealand, which up until that time was literally COVID-free. The issue of trust is one that has been raised. It is not one that we want to give into at this point in time because you see the results. We trusted the health authorities in New Zealand trusted two sisters to visit their dying parent. And they went all over the country, and spawned 320 cases. So Kim, as we say, we empathize, we sympathize. This is difficult. No one asked for this. No one asked to be caught in a foreign country when we close the borders. Many countries have done that. Many nationals of almost every country are somewhere in the world. They are horror stories. But the bringing back of our nationals into Trinidad and Tobago has to be a carefully thought out process based on a series of factors: capacity, risk, hospital capacity, all of these things. And the Minister of National Security, in my view, is doing a very good job. He's been very compassionate in difficult circumstances, and we continue to support him in this regard.
Thank you. Tobago Channel 5.
Hi, good morning. Candace Jackson from Tobago Channel 5. My first question is in regards to the number of test kits that we have in the country as we keep going forward, testing more and more places every day. I'd just like to know what is the current level? Are we trying to get more as we go on? And to Dr. Parkinson, you said that there's been some success in using the steroids with some of our patients here. And I was just wondering, is it safe to say that because of the use of steroids, we've prevented some of the deaths from occurring among our patients?
Okay, so I'll take the first part first. There are 14,000 test kits in Trinidad and Tobago for the use of Trinidad and Tobago only, and to that you have to add whatever capacity CARFA has. So this morning before we came here, we did a rough estimate. We have enough test kits in Trinidad at current usage to last us between 9 months to a year. So we're in a very fortunate place with test kits in Trinidad and Tobago, 14,000 for Trinidad and Tobago only, and then you have to add CARFA on top of that.
Okay.
Dr. Parkinson?
Okay, with respect to that, what you said there, I mean, you're trying to give us hope that yes, we have saved some lives in this country. I would like to say yes, but I want to use the statistics properly. The tests that were done, this study that was done in England was used with over 2,000 patients who were on the drug dexamethasone and over 4,000 who weren't on the drug. And they came up with the statistics. 30% of them who were, 30% improved over the ones who had no dexamethasone. So it works out about roughly treat every, to get one person to actually get better, you have to treat about almost 8 patients to get one person actually improving with the medication. I would like to say yes, people were saved by it, but our numbers are very small. I mean, remember, we were dealing with 6 to 10 patients, if that much, and these people in England were dealing with 2,000 at least for those who are on the drugs. I hope that clears it up a bit. But remember, as the minister said, and I want to clearly state, if you use steroids, dexamethasone, there is an oral form, yes there is. If you use that outside of ICU or the HDU, it will not benefit you. In fact, it will be dangerous to you. You will die. Oh, come, that's probably melodramatic, I agree, yes. You will most likely die because you open yourself up not only to the COVID, but to other infections as well. If you know friends and family who are on steroids like asthmatics, etc., when they put themselves on steroids, they are at a higher risk of infection. And of course, don't let me start to talk about the side effects of steroids. That's our next big topic.
Thank you very much. I go to 98.1. One question, please.
Yes, I just wanted to ask to ask a question, and of course, this question was already, I think the question was already dealt with, but this new drug that we've been talking about, I think the UK Prime Minister and his medical team seem to be very much excited about this new development, and I'm wondering, how us here in Trinidad and Tobago, we seem to be rather divorced from from some of those findings. I'm not sure, if we can do some further studies as to how this can benefit us here in Trinidad and Tobago.
Okay, so I will take part of the question. The issue of doing studies in Trinidad and Tobago is a mixed bag. To do studies, you need a large number of patients, correct, Dr. Parkinson?
Yes.
Unfortunately, we don't have a large number of patients to do studies. Because to do studies, you have to put half on the drug and half you give a placebo. We don't have, even at the height of our first wave, we never had enough patients in Trinidad and Tobago to do studies. So we just don't have the number of ill persons that you could do studies that gives you data which is reliable. So we could be guided by what is happening in larger countries where the caseload is in the thousands and hundreds of thousands. Okay? So, Mr. Cummins, I hope that answers your question.
Well, I see CNC3 hands went up late, so we'll have one question from CNC3, please.
Hi, good afternoon. Good morning. My name is Soini Gray from CNC3.
Good morning.
Hi, morning.
Morning.
I wanted to ask about the negative passengers who remain on the Enchantment of the Seas. Of course, initially they were being allowed to, they told us, come out of their cabin, twice a day for 45 minutes for fresh air, exercise, whatever. But now they've been placed under lockdown. They are now asking if that can be eased, or what is the criteria for easing the lockdown? They're citing physical concerns and also mental health concerns, being kept in a confined space. So I don't know if Dr. Parkinson wants to take that,
No,
or
I
if the
will
health
take it.
minister can take that. Thank you so much, sir.
That same question was asked on Monday, and the chief medical officer said clearly, no, not chief medical officer, Dr. Mariam Richards, said clearly that we provide medical, psychological and mental counseling once it is required, once it is asked for. The ship, I am told by Dr. Richards, in an effort to give those aboard a little more room, they have moved them to staterooms, which have a little more room. But we are trying to preserve the lives of those people on board. It is a quarantine facility. It is not your home, unfortunately. Quarantine does mean that there will be some restriction to movement. We understand the psychological trauma because they have gone through hell and back. They have been out at sea in some cases for 2 months, a month and a half. We understand all of this, but we are fighting a global pandemic, ladies and gentlemen. And I think this gets lost in all the advocacy to loosen up things. It is for their own safety, because if we don't do that and the cases spread, because there were 6 positive cases, it means they will have to spend even more time in quarantine. It means they can't go home sooner. We know this is difficult. I can't imagine what these people are going through. And we appreciate their need for advocacy and to contact the media and for you to advocate on their behalf. But as a responsible Minister of Health, it is our policy not to encourage persons on the cruise ship or any other quarantine facility, especially where 6 positive cases came out of, to have unfettered communication with each other, physical contact, to wander around the cruise ship. It is for their own good and to make sure they could get off that facility as early as possible and go back home and lead as normal lives as possible. It is difficult. It's a difficult situation.
Thank you. 95.5. We are almost out of time.
Yes, thank you very much again, Whitfield, to the I-95.5. Minister Cox, if I can ask you, earlier this week, you would have suffered some sort of a medical episode, and persons have been asking as to the status of your health at this time. I don't know if you're able to give us any insight as to how you're doing now and exactly what would have resulted in that particular episode.
Well, actually, I would like to say that it is not COVID-19 related, okay? So I don't have COVID-19, so let's just rest that down there. But yes, I have not been feeling well for the past just about a week and a half. And I went to the doctor, went to Mount Hope also, ran some tests. And the initial diagnosis is cervical spondylosis. I don't know, the doctors here would be able to understand what that is. But I have been getting some pains in my right hand, and actually it is still swollen. And I'm not totally up to par yet, but I just want to say thanks for your concern, and I just want to thank members of the media and the public for their concern. I got a lot of phone calls, WhatsApp messages, private messages, but I just want to say I am okay, and I'm doing better day by day. Thank you. And I think that brings us to the end. We've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As you would recall, in the midst of the pandemic, a diverse 22-member team chaired by Prime Minister Dr. the Honorable Keith Rowley were tasked with the responsibility for creating a COVID-19 roadmap to recovery for Trinidad and Tobago. They met, deliberated, and made recommendations. Starting this afternoon at 5:30 p.m. on TV6, we will share with you a production titled Roadmap to Recovery, The Foundation, Part 1. This production is your opportunity to hear from the team responsible for creating a COVID-19 roadmap for our country. But if you cannot tune in this afternoon, there is another chance to see it right here on TTT at 8:05 p.m. Synergy and IETV will also air the production tonight at 8 p.m. But if these times are still not suitable for you, you can still catch it even later at 10 p.m. on CNC3. The full schedule for the broadcast of Roadmap to Recovery, The Foundation, Part 1, is available on the social media pages and websites of the Ministry of Communications. We want to let you know that our next media conference will be hosted by Prime Minister Dr. the Honorable Keith Rowley, live from Tobago on Saturday, the 20th of June. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.
This is TTT. Live for local.